Studio. We thank you so much for joining us. It's our pleasure to welcome now Linda Allen Ley. She's a board member with the Mississippi Kidney Foundation, and also Dr. Debbie Miner. Linda, Dr. Miner, thanks for coming in today.
Thank you for having us.
Good
morning.
So you guys are trying to raise some money for the Kidney Foundation, right, Linda?
Yeah, well, everybody's trying to raise money these days, right, Deborah?
Right.
We talk about this all the time, and I call it fundraising fatigue because you go on Facebook, you talk to friends, you have neighbors, you get invitations, and everyone is in need of money these days. And it's just the times that we live in, and unfortunately the needs, they continue to increase. And when you talk about kidney failure, people always think often that, well, you must have done something to contribute to that, right? You don't take care of yourself, you're overweight, you drink. In Mississippi, the biggest issue that we have, as you know, Dr. Miner, is hypertension and diabetes. And it's a huge component in our community, and it's very expensive. It's extremely expensive. And I know this, if I don't mind me sharing this as a fact, because I had a hereditary kidney disease, and on Valentine's Day celebrated 7 years with a kidney transplant.
Congratulations.
Thank you. I never take a day without I thank my donor. It's a bittersweet gift. I had a cadaver donor. I had someone who died, a young man. So I don't ever take that for granted. But I do know that through my experience, dialysis, I did home dialysis. It was $4,500 a day. That was 10 years ago. It's extremely expensive. You go on Medicare, no matter how much money you make, you go on Medicare no matter what. But people don't understand that if we can hit the root causes and we can help early on, it makes a huge difference, and it also saves the state money, Medicaid, Medicare. And so why do you care? That's why you should care, because as a taxpayer, it takes money out of your pocket too, doesn't it?
Clearly. And actually, your situation's a little bit different because most kidney disease is preventable. And that's one of the goals of the Mississippi Kidney Foundation is to promote awareness of the risk factors for kidney disease. So in Mississippi, we have among the highest rates of kidney disease in the nation, and deaths due to kidney disease, but that really doesn't truly tell the story because most deaths aren't coded as kidney disease. Most people with kidney disease don't die from kidney disease. They die from hypertension, things that affect the heart and all that. But the kidney disease is related to that, and they're all, just we call it comorbid. They're looped together, and so really we could prevent in most cases with addressing those risk factors, and that's one of the goals of the Kidney Foundation is to raise awareness. We work with school systems, we work in the community, all across the state in that area. And then one of our major goals, and that's one of the reasons we're here, is to raise awareness, is we assist people who have dialysis. As you said, no one's on dialysis unless they're insured. It just doesn't happen. You don't get dialyzed without having coverage. But unfortunately, and this is particularly crucial in Mississippi, most people are underinsured. The dialysis is covered, great, but there are other medications, they can't afford those. They can't afford maybe sometimes the electric bill. We have things like, well, we won't even talk about some of the situations that come up. Our executive director, we could write a book about it. But these are people that don't have that help to even make it to dialysis, or, they need a transplant. Okay, I think you could afford the gas to get to your transplant evaluation, right? There are people that cannot afford to get the gas to get to the transplant evaluation. So that's some of the needs that the Kidney Foundation diligently supports to provide that financial and emotional support for kidney disease patients in Mississippi, and then raise awareness for prevention, like starting in the school systems. Oh, my goodness.
Yeah, going into the schools and talking to kids about it. Hopefully they go home and say, Mom, guess what? I learned that we really shouldn't eat fried chicken every day, or we shouldn't add too much sugar to our diet. And we're trying to think of, that's one of the ways that the Kidney Foundation is trying to break out of its box of just assessing the crisis as it unfolds. It's being preventative and going in, thinking outside the box. We have a big gala that's coming up this weekend. It is in the Jackson Metro. It is for everyone in the state, but it's one way to raise money. You played Teddy Swims just a minute ago. Lose Control. It was a #1 hit on Billboard
That's
Top
right,
100.
yes.
32 weeks in a row. I learned just recently that in the Grammys, he was nominated as Best New Artist, but he has now set a record as the longest-running male artist to sit on the charts. And Teddy is an individual that we've brought in who we are giving away through a raffle tickets to see Teddy Swims in concert in Fort Lauderdale, Hollywood, Florida, coming up May. We'll be announcing it Saturday, so we're running out of time for people to buy raffle tickets. And
But you don't have to be there. You don't have to be there to win.
And
How do you do it?
Gerard, you can live anywhere. You could live in DeSoto County. You can live on the coast.
Yeah.
You can live in anywhere you want in the state. You can live outside the state. $25 per raffle ticket. I believe it's 5 tickets for $100.
For $100, right.
We'll be drawing it Saturday night live at the gala. And you've got the address there for the Give Butter, which the money, every single cent goes directly to the Kidney
That's
Foundation.
right. And it stays in Mississippi. So we're a little unique in that area. Every dollar raised, and we have our ratio of expenses to what we give out is about the best you can you can do. We're very much a volunteer-led organization, and annually we provide assistance to over 1,200 people. And then, of course, many, many other things. But every single dollar is very carefully spent to max out the aid that we can provide and the support.
You've got the addresses in front of you.
Oh, I
Can you
do,
give those
and
to
we can
everyone,
post these
please?
too. It's, of course, HTTPS, semicolon, backslash, splash, splash, give butter, .com, 2025DD, or you can actually get to the Teddy Swims tickets through that site too.
Yeah, and you can go to the kidney.org website as well, and that way you can read about what we're doing, or you can read about the gallery. There's still tickets available for the gallery. Dressed up and come out and hang out with us. Gerard, you can come and hang out. I'll buy you a free cocktail.
and we have silent auction items too, and you do not have to be present. And actually, we have raffle tickets for the drawdown, and those you can get $5,000.
Yeah.
So we sell those separately too. So there's all kinds of opportunities to support the Kidney Foundation.
We of course live in a state that's unhealthy.
Very much so.
I think the most unhealthy, if I'm not mistaken, in the country.
We're
based
second
on
now,
very-
by the way.
Okay,
We-
we've
we-
moved
well,
up the
it's
ladder a little bit.
Virginia beat us out.
It depends on which
think
and
we
when you
kinda
look
go-
at those
yeah.
statistics.
Yeah.
We and the individual things, So we always tie, or we flip back and forth.
Always the top 5 in the bottom, which is sad for us, whether it's obesity in our children, whether it's health, education, and we want to try to change some of that. And, it starts with a small seed. Someone will say, well, I can't make a difference. Well, you can make a difference. Sometimes it's just reaching out into your community. If you can't give of tithings, then you can give of time. There are lots of ways that you can give back.
Yeah. So what do we got to do to just get people to realize that a lot of the lifestyles, I should say, that we lead in Mississippi are not healthy for us, that there's minor things even that we could
they're
do
very minor things that you can
could
do.
really change the tangent quite a bit.
Well, there's a lot that we can do, but I believe fully that it starts in childhood and it starts with working with families. I think that we have had a precedent set in our state. Dr. Bauer, everybody I think in our state knows who Dr. Bauer was. He was just this wonderful person that actually worked very closely with. Had several, initiatives that he and his foundation funded, like working with the Department of Education and the Office of Healthy Schools. We put in some of the most progressive legislation in the nation under Governor Barber to support better health in schools. Like we took all the deep fat fryers out, we put the convection ovens in. So there are ways to do that. So those kids, they're eating healthy lunches if they're in public schools. Now what they do after school is the issue, and more access to healthy foods, making activity a part of everyday life, making exercise what we call exercise. It's not exercise; it's part of everyday life. Making sure awareness. So I work in the areas of hypertension, diabetes, etc., and making sure people are aware of those diseases. So we've made great progress, but we still pretty much. Access is a major issue, and then finding what works for individuals. It can be very, very different. What works for an individual to get them motivated.
I think my business partner always talks about the 6 inches between your ears, and I really think it's a mindset that we have to all start to think about. In that, he always says that if you do something once or twice a week, it's a hobby. if you do it 2 or 3 times a week, it's a good start. To really have a lifestyle and a change, you have to do it every single day. And it doesn't mean that you have to be in the gym an hour every day. It doesn't. It just means minor modifications, and minor modifications can make a huge difference. But most of us, let's be fair, we don't want to.
Right.
We just don't want to, right? If that piece of cake is sitting there and it looks really delicious and we got a cup of coffee, am I going to be more likely to eat a bowl of oatmeal or something healthier for me, or that piece of cake? And we've gotten spoiled as a society. We want what we want when we want it, and we're seeing the repercussions of that in our health, in our communities, in our education, and everything that we talk about.
Tell us again before we go how we can donate.
Okay.
Give us that address.
If you would please go check out our websites. If you want to apply for the Teddy Swims raffle tickets, we are drawing that coming up. It's about a $10,000
What a
package.
deal. Yeah.
GiveButter.com/2025 Teddy Swims. You can also do the GiveButter.com/MKF Teddy Swims. And so.
Got to go. Hurry up.
Thanks, Gerard.
Look
Appreciate
at the
it, guys.
Mississippi Kidney Foundation website.
Got it.
Yeah.
Thanks, guys.
Appreciate it.
Thank you.